It was on Monday, the 23rd of March, nearly 7 weeks ago, that Boris Johnson first announced a lockdown and urged us all to stay at home and save lives. At that stage, 336 people in this country had died in hospital because of COVID-19. The reproduction, or R rate, at the start of the epidemic was 3. So for every one person infected, 3 more were infected, and then 3 more infected after them, and so on. As lockdown came into force, the R rate fell to around 0.6. But because the virus was already exponentially growing, the number of deaths continued to rise. On the 21st of April, 1,172 deaths were recorded in a single day. But as the R rate fell in time, so too did the daily numbers of deaths. Today, 269 deaths were recorded. The R rate is now thought to stand somewhere between 0.5 and 0.9. In the community, the outbreak is shrinking fast. But in hospitals, and particularly care homes, the virus has continued to spread, which is why that reproduction rate might have risen slightly. And whilst cases have been falling and the R rate is still low, there is very little flexibility before we start to see the numbers exponentially rising again.
We've got a very narrow opportunity in the next few weeks to keep control of the R naught, the infectivity of the virus, at the same time getting society back to some version of normal. If we screw up, the virus will continue to labour along there and make us go back into lockdown, then come out again and go back. That's not what we want. We've got to do it in a controlled way.
As soon as the number of people one person infects rises above 1, COVID-19 becomes very hard to contain. If that number is below 1, the virus isn't being sufficiently spread to sustain an outbreak. Easing lockdown and keeping that R rate low will be a big challenge for the government.